Hello, class. Today we're going to be talking about Chapter 12, which is drugs for cardiovascular diseases. We have some chapter topics: the cardiovascular system, angina, arrhythmia, heart failure, hypertension, myocardial infarction, blood clots, stroke, cholesterol abnormalities and related diseases, varicose veins, and complementary and alternative therapies. Our learning objectives are to describe the anatomy and physiology of the cardiovascular system, describe the drugs and treatment for each type of heart disease, recognize anticoagulant and antiplatelet drugs and know their functions, explain stroke and the drugs used to treat it, identify drugs used to treat hyperlipidemia, and understand its role in heart disease and stroke treatment. So the cardiovascular system, we're going to dive into that. And for the last decade, the number one cause of death in the United States has been cardiovascular disease or heart disease. I think that's the second one, I believe, is cancer. But this is a major problem, especially in the United States. So it's very important for you as a pharmacy technician to understand the drugs that are involved with the cardiovascular system and how they work. So the cardiovascular system circulates blood throughout the body, bringing oxygen and nutrients to tissues and carrying away carbon dioxide and toxic byproducts. The arteries carry blood away from the heart to the tissues. Veins carry blood to the heart from the tissues, and capillaries are tiny blood vessels where critical fluids, gases, and nutrients are exchanged. Here's a model of the cardiovascular system. You'll see the different capillaries here and pulmonary capillaries in the lungs. Your book goes into a little bit more detail about these diagrams. There's a lot of information here to cover, and I don't want your lecture to be over an hour. So we're going to just kind of breeze through some of these diagrams. And like I said, just review those in your textbook. So the heart. There's the SA node, which is a group of specialized cells where the normal heartbeat starts. Depolarization is the flow of positively charged sodium and calcium ions into cells, making the voltage positive. Repolarization is the flow of positively charged potassium ions out of cells, making the voltage negative. And action potential is an electronic burst. When an action potential arrives at a myocardial cell, it depolarizes with an inflow of sodium and calcium and repolarizes with an outflow of potassium. Causative factors of cardiovascular disease. There's a lot of different ones, but what we're going to cover is predetermined factors such as hereditary, gender, and increasing age, and factors influenced by lifestyle modifications such as cigarette smoking, high blood pressure, high blood cholesterol levels, obesity, and diabetes. So what roles do arteries, veins, and capillaries play in the cardiovascular system? Arteries carry blood away from the heart to the tissues. Veins carry blood to the heart from the tissues. And capillaries are very small blood vessels where fluids, gases, and nutrients are exchanged. Angina pectoris. So you might have heard this before. There's different pronunciations. A lot of physicians say angina, but I've also heard angina. So I'm going to go with angina. The definition is chest pain due to an imbalance between oxygen supply and oxygen demand. It does not cause irreversible changes. There's different types of angina, such as stable angina, unstable angina, and variant angina. Symptoms and risk factors of angina include chest discomfort, sweating, dizziness, and dyspnea, often triggered by exercise or emotional stress. The risk factors are advanced age, coronary artery disease, hypertension, increased serum glucose levels, increased serum lipoprotein levels, obesity, smoking, and a type A personality. Anti-anginal drugs, there's several of them. One is a beta blocker. The way they work is they inhibit the action of catecholamines on beta receptors. They decrease your heart rate, decrease myocardial contractility, and decrease blood pressure. The non-selective beta blocker blocks both beta 1 and beta 2 receptors, and beta 1 associated with heart function, beta 2 is with the lungs. Cardioselective beta blocker are more selective for beta 1 than beta 2 receptors. And the therapeutic uses include angina, arrhythmias, hypertension, myocardial infarction, and heart failure. Good rule of thumb for beta blockers, the majority of beta blockers are going to end in OLOL, so olols. So we have acebutol, atenolol, carvedilol. Most of them are going to end in OLOL. So just remember that when you're on the job in a retail or inpatient hospital setting, you'll know what drugs are. You can recognize them by their suffixes. There's also a class called nitrates. So some of those include isosorbide dinitrate or isodil, and then nitroglycerin. The way they work is they relax vascular smooth muscle, which reduces the preload. You'll see those two a lot in retail, especially nitroglycerin once you've had a heart attack, or if you do suffer from angina. A lot of patients will be prescribed nitrostat, which is a sublingual dissolving tablet for nitroglycerin at the onset of chest pain. There's also calcium channel blockers. These lists of drugs are quite extensive, so we're just going to kind of go over them briefly because, like I said, I don't want your lecture to just be hours long. So for calcium channel blockers, there are things such as amlodipine, diltiazem, nicardipine. A lot of the calcium channel blockers suffixes are going to be ipine, so IPINE. That's a pretty solid indication that they are calcium channel blockers, but not all calcium channel blockers will end in that. So you have diltiazem, for example, or verapamil, which don't. The way they work is they prevent calcium from entering into cardiac muscle cells during depolarization by blocking the slow channels. We have a metabolic modifier, Renexa. That one's not as commonly used in retail. You won't see that one too often, but it assists the heart to generate energy more efficiently by allowing it to function despite a decrease in oxygen. Arrhythmias alter your heart rate and rhythm. There's different terms that you should recognize. The SA node generates normal cardiac rhythm at 70 to 80 beats per minute. The ectopic pacemaker, a pacemaker other than the SA node, and tachycardia is excessively high heart rate. Here's some more medications for you that are used to treat arrhythmias. The membrane stabilizing agents are class 1. So we have Norpace, Tambacor, Rhythmol. So the propafenone is Rhythmol, and that one is actually one that you might see quite often. A lot of your older patients or patients who suffer from cardiac disease are going to be on Rhythmol. The way they work is they slow the movement of sodium into myocardial cells, reducing the ability to generate an action potential. This dampens potential abnormal rhythms and heartbeats. We have potassium channel blockers, amiodarone, Nexterone. Those are pretty common as well. The way they work is they delay the repolarization of atrial and ventricular fibers by blocking the flow of potassium across cell membranes. Other agents that are used for arrhythmias are beta blockers, calcium channel blockers, atropine, digoxin, and isoprel. As I mentioned before, a lot of these medications can have multiple indications. So, for example, like the beta blockers are also used to treat hypertension. They can also be used to treat arrhythmias. There's multiple indications for a lot of these medications. So heart failure is defined as a chronic progressive condition in which the heart is no longer able to pump enough oxygen-rich blood to meet the body's needs. Symptoms of heart failure include shortness of breath, fatigue, edema, and exercise intolerance. The goals of therapy would be prolonged survival, relief of symptoms, improvements of quality of life, and prevent progression of the disease. The drug therapy for heart failure most of the time is going to be ACE inhibitors, beta blockers, diuretics, and digoxin. Treatment for heart failure is a vasodilator, such as isosorbide dinitrate. And the way it works is it reduces the resistance against which the heart must work. Another one would be ACE inhibitors, um, which would be lotensum, capoten, monopril. A lot of the ACE inhibitors end with pril, P-R-I-L. That's another way to remember those and their classifications. The way they work is they inhibit the conversion of angiotensin 1 to angiotensin 2, a potent vasoconstrictor. There's other agents that are used, such as aldosterone antagonists, beta blockers, antiarrhythmic medications, and human B-type natriuretic peptides. Hypertension is high blood pressure. Blood pressure is the product of cardio output and total peripheral resistance. Your cardiac output is the preload, afterload, and contractility. Systolic blood pressure is the pressure when the heart ejects blood, and diastolic blood pressure is the pressure when the heart relaxes and fills. Blood pressure notation is systolic over diastolic pressure. The definition of hypertension, as I mentioned before, is elevated blood pressure. Here's a little description of when hypertension should be treated and the age category there. So, like when to treat in a patient above 60 years old is 150 over 90. Less than 60 years old would be 140 over 90. And if you have diabetes or kidney disease, it's 140 over 90. There's different risk factors, including family history, cigarette smoking, high-fat diet, and additional factors would include kidney disease, decreased pressure or delayed pulse in lower extremities, obesity, adrenal tumor, and use of certain medications. Untreated hypertension can cause cardiovascular disease, heart failure, renal insufficiency, accelerated cardiac and peripheral vascular disease. There's different therapies, including modifying your lifestyle factors, such as exercising more, eating lower fat diets, stop smoking. There's monotherapy and an additional drug and add a third agent. Excuse me. So there's antihypertensive therapeutics, such as angiotensin receptor blockers. They're listed here on the left, and the way they work is they block angiotensin 2 receptors, thereby preventing constriction and causing blood vessels to relax. The one that you'll probably see the most in retail would be Avapro or Cozar, also Benicar, and Diavan. There's central nervous system agents such as clonidine and guanfacine. The way they work is they stimulate the alpha-2 adrenic receptors in the brain, leading to decreased heart rate, cardiac output, total peripheral resistance, plasma renin activity, and blunting of baroreceptor reflexes. There's other agents including diuretics, peripheral acting agents, direct renin inhibitor, and combination of drugs. There's descriptions there. Your book does go in more into depth in those in chapter 12. And like as mentioned here in this chart, diuretics are discussed in the previous chapter, chapter 11, as well as peripheral acting agents. Myocardial infarction is defined as when the flow of oxygenated blood to a section of the heart is blocked. It's also known as a heart attack. The causes of a heart attack are narrowing of the lumen of one or more coronary arteries by 70% or more. Risk factors include a history of angina, alcohol consumption, reduced pulmonary vital capacity, cigarette smoking, and atherosclerosis. Symptoms would include chest pain or discomfort, upper body discomfort, shortness of breath. Other symptoms are cold sweat, unusual fatigue, nausea, vomiting, lightheadedness, and dizziness. The treatment would include opening of blocked arteries, control blood pressure, regulate heart rhythm. In acute phases, oxygen and nitroglycerin and aspirin can be used to treat or prevent. And chronic therapy would be anticoagulants, antiplatelets, beta blockers, ACE inhibitors, medications to treat cholesterol. Blood clots. It's called a thrombus or thrombosis if you have like deep vein thrombosis. They're blood clots transported in the blood. Pulmonary embolism is a piece of a clot which breaks off and travels to the lung, blocking the pulmonary artery. Deep vein thrombosis is venous thrombi form in areas of low velocity blood flow, surgical or other vein injury, or large venous sinuses. Anticoagulants prevents clot formation by inhibiting clotting factors, and antiplatelets reduce the risk of clot formation by inhibiting platelet aggregation. So there's different tests that can show blood clots. There's the PTT, the PT, and the INR, and there's different drugs that affect those as listed in that chart. Your book will go more into depth in those if you would like to look at those more closely. Some anticoagulant agents include direct thrombin inhibitors, which is bivalirudin or dabigatran. The way they work is they bind directly to thrombin. They can inhibit circulating thrombin as well as thrombin bound to fibrin. Heparin is one you'll see very often in an inpatient hospital setting. The way it works is it inhibits thrombin formation, thereby reducing the ability of blood to clot and preventing the formation of a new clot. An antidote for heparin is protamine. That's in case you get an overdose of heparin or you have an adverse reaction to it. So there's also low molecular weight heparin, such as enoxaparin and dalteparin. Those come generally in pre-filled syringes, and you will see those dispensed in retail and hospital settings alike. The way they work is Lovenox is it works by preventing thrombosis after surgery, treatment of DVT with or without pulmonary embolism, and those can be injected at the site where a deep vein thrombosis might be occurred or where you might have a blood clot. And then the fragment is used to prevent thromboembolism. Factor XA inhibitors are also another anticoagulant agent, such as Eliquis. That's probably the one you'll see the most often. The way they work is they block the activity of factor XA and prevent blood clots from developing or getting worse. Warfarin. Can't say enough about Coumadin and warfarin. You'll see that a lot in a retail setting, also in a hospital setting. A lot of patients who have heart disease are going to be on warfarin. The way it works is it inhibits the vitamin K dependent clotting factors. There's a lot of cautions and considerations to be aware of when dispensing warfarin. You can familiarize yourself with them, then they're on the right. An antidote for warfarin would be phytonadione or vitamin K or fresh whole blood. So warfarin is a blood thinner. If you overdose on a blood thinner and your blood becomes too thin, then the phytonadione will counteract that. And here are some drugs that can interact with warfarin down here on the bottom half of the screen. That list is pretty extensive. So general antiplatelet drugs here, aspirin, Pletol, and Plavix. Plavix you're going to see a whole lot. That one's a very common drug. And as well as aspirin, a lot of patients are on an enteric-coated aspirin regimen daily. Some more antiplatelet drugs there. Glycoprotein antagonists, Riapro. You'll see that one occasionally. The way it works is reversibly bind to a receptor or platelet, preventing platelet aggregation, as well as binding of fibrinogen. Here's some other More drugs. There's a lot of drugs, as you can see, to treat all forms of cardiovascular diseases. Just going to go these. All right. Determine whether each of the following drugs is an anticoagulant or antiplatelet. Heparin is an anticoagulant. Apixaban, anticoagulant. Efient, antiplatelet. So now we're going to talk about strokes. A definition of a stroke is the result of an event that interrupts the oxygen supply to a localized area of the brain. Transient ischemic attack, or TIA, is temporary neuralgic changes during a brief period of time. Symptoms of a stroke include sudden numbness or weakness in the face, arm, or leg, sudden confusion, difficulty speaking or understanding speech, sudden trouble seeing in one or both eyes, sudden dizziness, loss of balance or coordination, sudden severe headache with no known cause. There's different types of strokes here that are discussed. There's different risk factors for strokes. Not modifiable or cigarette smoking, coronary artery disease, diabetes, excessive alcohol intake, hyperlipidemia, hypertension, obesity, and physical inactivity. We also have age, gender, genetic predisposition, prior stroke, and race. Stroke management, there's different medication classes here that are used to treat those: the antiplatelets, anticoagulants, fibrinolytic, and aspirin dipyridamole. Which of the modifiable risk factors for cardiovascular disease and stroke overlap? Cigarette smoking, diabetes, hyperlipidemia, hypertension, and obesity. Cholesterol abnormalities and related diseases. So you have hypercholesterolemia, which is an excessive amount of cholesterol in the blood. Hyperlipidemia is a condition in which the levels of one or more of the lipoproteins are elevated. And dyslipidemia is a condition where levels of atherogenic lipoproteins are elevated and or levels of anti-atherogenic lipoproteins are decreased. There's a excuse me, a picture here on the right that shows the plaque in the arteries and how a thrombus can form. There's different causes of dyslipidemia, such as genetic or inherited, and a diet that's high in saturated fat. Lipoproteins are high-density lipoproteins, transport cholesterol back to the liver for excretion. The high-density lipoproteins, or HDL, is the good cholesterol. The LDL, or low-density lipoproteins, are bad cholesterol. They bring cholesterol to body cells and may be deposited in arteries. Triglycerides are neutral fats from carbohydrates for storage in fat cells. These are a class of drugs, the statins, that are used to treat high cholesterol. The statins are Lipitor, Mevacor. You're going to see these a lot in retail. These are also a class of drug that will interact with grapefruit juice, so just be aware of that one. You might see that on a auxiliary label when you're dispensing medications in retail. It says don't eat with a lot of grapefruit. The way they work is they inhibit the enzyme that catalyzes the rate-limiting step in cholesterol biosynthesis. Here's some more of the fibric acid derivatives, such as tricor, trilipics, and lopid. Bile acid sequestrants, cholestyramine, you'll see quite often, colisted. They block cholesterol absorption and decrease cholesterol synthesis. Some more Zetia, Niacor, Niaspan, Metamucil, just fiber products. Those are all very common cholesterol agents. Another way to treat cholesterol abnormalities are omega-3 fatty acids, such as Lavazza and Vascepa. They're derived from fish. And then combinations of different drugs that are listed there below. Which classes of drugs are used in the treatment of hyperlipidemia? All of those listed there in the green. There's a plethora of cholesterol agents. Varicose veins. The definition of varicose veins would be veins which the valves no longer function properly, allowing blood to travel back towards the extremities. Complications of varicose veins are inability to walk or stand, skin ulcers and conditions, severe bleeding from minor trauma. There's different treatments for them. You can use support hose, which is probably the most common. There's just different options. It's not just that they're unsightly, it's that they can cause health problems. Complementary and alternative therapies. Plant sterol esters are found to significantly lower LDL cholesterol. They're adjunct to diet and drug therapy for hyperlipidemia. And beta-sitosterol found in margarine and juice. Red yeast rice, alpha tocopherol or vitamin E, and garlic are all alternative therapies. Okay, we have a chapter summary here. Angina pectoris is an imbalance between oxygen supply to the heart and oxygen demand from the heart. Drugs used to treat angina include beta blockers, nitrates, calcium channel blockers, and metabolic modifiers. Normal heart rhythm is generated by the SA node. The classes of drugs used to treat arrhythmias are Class 1, membrane stabilizing agents, Class 2, beta blockers, and Class 3, potassium channel blockers, Class 4, or calcium channel blockers. Class 3 was potassium channel blockers. Heart failure occurs when the pumping ability of the heart can no longer sustain blood flow needed of the body. Medications used for heart failure include vasodilators, ACE inhibitors, and human B-type natriuretic peptide. Drugs commonly used for hypertension include ACE inhibitors, angiotensin II receptor antagonists, beta blockers, calcium channel blockers, and diuretics. MI occurs when there's a prolonged decrease in oxygen delivery to a region of cardiac muscle, which dies. MI is myocardial infarction. Beta blockers and low-dose aspirin are prescribed to reduce the risk of death or recurrent following an MI. Blood clots in the bloodstream can cause life-threatening pulmonary embolism and other serious damage. Anticoagulants, antiplatelets, glycoprotein antagonists, and fibrinolytic agents are used in the management of blood clots. A stroke may be caused by either a cerebral hemorrhage or a cerebral infarction. Antiplatelets and anticoagulants are used in the management of a stroke. The liver packages triglycerides, cholesterol, and carrier proteins as lipoproteins, which circulate in the blood. Drugs are used as an adjunct to diet to treat dyslipidemia.